to all GE diagnostic modalities all over the kingdom here, including the ECG, stress Holter, and blood pressure, and the cardiology management system, which called the Muse, which you have in your institution here. So today we'll talk about our recently launched ECG machine. As you can see, we did a lot of changes when you compare it to the previous version on the physical perspective and as well as on the algorithm running on the machine. So on the physical perspective, as you can see, the screen size is much bigger than the previous one. It is 15.6-inch size screen, and it is a touch screen now. So what we added to our acquisition module here, so you can find some torso lights. So these torso lights will let you know if this lead wire is working fine or not, if it is bringing signals or not. We fixed the ECG cable more to our acquisition module to help you transmit signals on a better way. And we added one arm to the side here to help you adjust the height of the machine as needed to help you acquire good reports for your patients. Now getting back to our workflow on the machine. So today we'll discuss two things. How to manipulate in the machine to let you get better reports, and we will discuss our workflow with the track care system or the hospital information system. Okay, so upon starting up the machine, this is your startup screen. So what do we have in here? Let's start from this side. So at this side you can find two arrows up and down. So it will take you between two pages only. So this page, it's talking about the lead placement map. So upon placing your leads, this one will turn into green with a green indicator as well to let you know that you placed your lead properly or not. Now on the top here we have the Wi-Fi signals. So the machine is connected via Wi-Fi to the hospital network. So if you have doubts if it is connected or not, just do one press on it, it will tell you if it is active or disconnected. Next to it we have the batteries level. So the machine has two batteries. Every single battery will last for 3 hours. So as came from the manufacturer, as much as you don't use the machine, please keep the machine plugged in. Even if it is fully charged, it will not affect on the battery's life. The three white stars here, the BPM, the heart rate of your patient. So upon hooking up your patient, it will transfer into numbers. All patient demographics will show up in the upper bar here, as you can see. So getting back to our workflow, as you know, we have these lead wires we call integrated with the grabber connector. So this is the best lead wire ever you can use for your patient. So we have this grabber connector. The metal part will be attached directly to the metal part of your electrode. And your grabber connector is integrated with the lead wire. It means that all signals, every single move will be detected by the system and transmitted. So you have the best lead wires here. So we have 10 lead wires. We know where to place it. So it's going to be 6 on the chest and 4 on the limbs. The 6 chest leads on the chest will be starting from the 4th intercostal space, right and left to the sternum. Then V4 will be at the midclavicular line. V3 in the middle between 2 and 4. Then 5 and 6 will be at the anterior and mid-axillary line. So upon hooking up your patient, you have to check your hookup advisor indicator. So remember we talked about these indicators, torso lights in here to tell you if the lead wire is working fine, the lead placement map if you placed properly or not. But the main indicator you have to keep an eye on, something we call hookup advisor indicator. Okay, so we have 3 indicators in this hookup advisor. We have the green, yellow and red. Your target must be the green indicator all the time. How to get the green indicator, as you know?
We place correctly.
Absolutely. So, with preparation of the patient, right placement of the leads, and try to relax the lead wires as much as you can in your patient. That will reduce the level of artifacts. The yellow indicator, we still say it is acceptable because sometimes we deal with senile patients who has the muscle tremors. So with the muscle tremors patient, the indicator will be between yellow and green, still acceptable. If you deal with a psycho patient who's moving a lot or a pediatric patient, the indicator also will be between yellow and green indicator, still acceptable. If your patient or your machine is sitting next to a generator room, it will never be green, it will be yellow all the time. So only with these cases we can say that the yellow indicator is acceptable. Now if I did hook up my patient properly, and I'm sure, but my indicator is red, and I can see a clear waveform here, what to do? Please do not acquire your ECG. Because it will be a wrong ECG with the wrong interpretation, and you will misguide your physician in their management to the patient. Okay? So now what we developed in our machine here, something we call auto ECG. What does auto ECG mean? It means upon hooking up your patient, the machine will detect the best 10-second signals coming from the patient side and acquire the ECG automatically for you. But it will let the decision for you to decide accept or reject. Okay? And I will show you how well it runs here with the simulator. Okay, so first step, hook up your patient. Second step, check your hookup advisor. Third step, start enter your patient demographics. You will use this blue icon here. So upon pressing the blue icon, we will come to our part with our workflow with the hospital information system, the track care. So our workflow depends on placing an order in the system. So if your physician is looking for an ECG, please ask him to place an order. If you have the privilege, just place an order before you go to your patient. So we will retrieve that order with all patient information to the machine. We will attach one report to it and send it back. In this way, it will show up under the patient's profile directly. So one equation needed to be remembered all the time when you do an ECG for your patient. One order, one report, it will show up under the patient's profile. One order, two reports, it will be stuck in Muse waiting for someone to delete unneeded report to show up under the patient's profile. No order with a report also will be stuck in Muse waiting for someone to attach that order to the report manually to show up under the patient's profile. Okay? So I know sometimes we do an ECG for our patient and in a moment we figure out that we have better signals. Then we acquire another ECG. We don't have to do that anymore. We developed our machine to help you not to do that anymore. Okay, I will explain it to you in here. So now getting back to our workflow on the machine, and let me turn the simulator on now. Sorry, before I do that. So we said that we will acquire the ECG for our patient. We will retrieve all patient information. So here in your patient information, you can find 3 red stars. These are mandatory fields. So mandatory fields for transmitting. It will not be mandatory fields for acquiring. So it will not stop you acquiring an ECG, but it will stop you transmitting any rubbish to the system. So what will you do? I'll start enter the MRN for my patient, then I will do search. So upon doing search, it will autofill the spaces in here. So you can find the 2 patient IDs, the gender, the age of your patient, and you have a space here for the technician. You can add your name on it. So if you are doing a good ECGs, why not to sign it? So put your name on it. Then when you do that one, you will do save, and you will find all patient information in the upper bar here. Okay? Then you are ready to acquire the ECG. But before I do that, because it's a real patient, let's turn the simulator on, and I will show you the auto ECG. How will it run on the system?
This, when we search the patient ID number, it will attract from the health information system?
Absolutely. It will bring it from the health information system with the order placed over there.
And even first time, we just need to do so.
Absolutely. Okay, so now let's imagine that we did attach our patient here. I didn't do any ECG. Look at the ECG here is running. The auto ECG is trying to detect the best 10-second signals. I didn't touch the machine. It will do the ECG for you. So while the machine is doing the ECG, you can start entering the patient information and save time. So now it will let the decision for you to decide. So what are the options I have in here? Accept, reject, and
Cancel.
and minimize.
Minimize.
So why do I really need to minimize? So remember we said that we have one equation, one order, one report.
Yes.
We don't have to do the duplicate anymore.
To review.
So here we have the live ECG running. So in the previous versions of our ECG machines, you used to print out them to be able to see the live ECG. Now you don't have to do that anymore and duplicate reports. So you have the live ECG, you have the report you acquired or the machine acquired is next to it. So if you have better signals, you can just start another ECG. It will override the previous one. So you still have one report attached to the order you retrieved. Okay? Then you will do accept. So upon doing accept, what will happen?
This report.
It will start printing out the ECG. It will do the auto save. It will do the auto transmit. So please make sure that you don't press the accept button unless that you are sure that this is the report I want to save under my patient's profile. Okay?
Understood.
So now after I acquired the ECG here, I have the options done, edit, delete, whatever you want, you can do. Even edit patient demographics. So if you are in a hurry and you did an ECG, get back here, fix the patient information, then transmit manually. So if I press done, start a new ECG patient, it will take you to the new patient demographics list to start retrieve another patient information. So now, getting back to our workflow on the machine. Hook up your patient, check your hookup advisor, start enter patient demographics, then you are ready to acquire the ECG. Before I do acquire the ECG for my patient, is a check what else do I really have in the machine can help me do better reports for my patient. So we have these 3 dots here. These 3 dots is standard configuration for the speed, gain, and filter. So speed is 25 millimeter per second. The gain is 10, and this is for adult. For pediatric, you have to reduce the gain to 5 or even 2.5 because we all know that pediatrics gains are high, right? And the filter was really important for you. So if you do your workflow properly, you did hook up your patient, you have the green indicator in here, but you still have some noise, some artifact. Your report is not clean. If you print that report, your physician will push back that ECG and ask you to repeat it because the physician is looking to recognize where the P wave started or where the QRS stands. They want to do their own measurements on that ECG. Okay? So we have to clean that report for them. How to clean the report? With the filter here, you can reduce it to the 40 or even to the 20 and check the picture. It will be clean or much cleaner than the previous version you had it on the screen. Then you can do an ECG for your patient. Now, how to do the ECG for my patient? I have 3 ways to do the ECG. I have the 3 colored buttons here, ECG, rhythm, and stop. The same 3 buttons, you will find it on the acquisition module, ECG, rhythm, and stop. So if you are next to your patient, you don't have to get back to machine to press the button, just press from here. And the 3rd way will be on the screen, start ECG, start rhythm. So ECG, this is the 12 lead ECG report, the one which we are familiar with. Rhythm report, what's the rhythm report?
To check which rhythm.
Some physicians call it long leads report, or you'll find your physician asking for 4 pages ECG or 6 pages ECG. So rhythm report, if you press on the rhythm button here, it will start printing the whole 12 leads on a rhythm way, and it will never stop till you ask it to stop. So we didn't fix a time for it because it's different from physician to another. Someone will ask for 30 seconds, a minute, 2 minutes, even up to 5 minutes rhythm report. So what we developed in our machine with this version, that you can save up to 5 minutes rhythm report digitally on the machine, and you can transmit it digitally to the patient's profile. Okay? So let's do an ECG for our patient. So remember the equation. We said 1 order, 1 report. Start ECG. The options you have in here. If you have doubts, just minimize. Check your live ECG. If you like it, accept. Unless do another ECG, it will override the previous one, and the rest you know. So upon pressing that one, again, it will print out, it will do the auto save, and it will do the auto transmit. Later on, you will find yourself without printing out. Hospital is looking for the paperless workflow. So please practice as much as you can. You do accept that this is the report, I want to show it for my physician under his profile, so the physician will check it from there. Okay? So you don't have to print out anymore later on. And it's going to be only as an option in the machine. So now where to find my saved reports? Remember we said that we have 2 pages at this side. This is the lead placement map. So the arrow up and down will take you between these 2 pages. So the second page is the files. So these are the whole reports you acquired on the machine. So this is the report we acquired just now. And this is the report you acquired before. These flat lines, okay. Okay, so this is the report we just acquired. Now what's really needed to be checked at this list, that I have the 2 arrows in here, and you have to know that
Maximize.
with this version of our machine, you can save up to 1,000 reports in this machine. 1,000 is not a small number, okay? But unfortunately, it will not do an auto-delete when it is full. So it depends upon your workflow here. So if you are doing 1 ECGs daily, let's say after a week you have to schedule it that we have to delete this report. So if you didn't delete and you find that alert on the screen, full memory, please do not ignore. You have to go back to the files, delete some reports, then acquire an ECG. Why is that important? Because I want to see if I do the save after acquiring the ECG, I want to check the sent status. So the sent status is showing up in here when you do the expand, the check mark. It will tell you that you did transmit that one successfully. Sometimes there is a network interruption, so it will be stuck in the machine. So you cannot just select all and delete. You have to check if it was sent or not before you decide to delete it. So now we have 1,000 reports saved in the machine. We have this little arrow here. So this little arrow next to the column, it will do the sorting with the acquisition date. You can do the sorting using the last name or first name with the alphabetical sorting. You can do the sorting with the MRN of your patient, as well as you can do the sorting for the sent reports and unsent. So from unsent to sent or from sent to unsent. Okay? And you can minimize. So the last thing in our session today, it will be how to load papers to the machine. So we have delivered a new version of papers with this machine. So here you have your tray. So just to place your hand, open the tray. We added a hole to the lower part of the tray here. Did you check the amount of paper before you run a rhythm report for your patient? So you don't want to be interrupted in the middle. If your physician is looking for 5 minutes rhythm report, you cannot after 3 minutes find yourself out of papers and continue. You cannot continue. You have to repeat everything back. So you can't check the amount of paper. So this paper is the old version of our papers. It has the reader hole. So your reader hole will be in the upper left part of the machine. It will work fine with the machine. But we prefer to use the other version, which was delivered with the machine. And it has a different indicator. Okay? Wait. I will use this pencil.
Candle.
Okay? So we have this type of papers. We recommend to use this type of papers, which was delivered with the machine, and later on will be a stock item in your hospital. So it has a black square on it. So this is your new indicator will be with this type of paper. So your black square will be in the lower left part of the machine. So you place it on that way. It's gonna be fit to the tray size. Take a piece of a paper out, then close your tray. So please make sure that your indicator will be in the lower left part and you are printing on the right face. So if I put it on that way, my indicator is on the lower left part, isn't it? But if I place my papers, I'll start printing on the wrong face. So please make sure that your indicator in the lower left part and you are printing on the right face. Take a piece of a paper out, then close your tray. Thank you very much for attending this session. If you have any further questions, please go ahead.
You said no, we can send it is not sent. How we can send it? You said also.
Start do the ECG. Do the ECG for your patient. This patient, as I said, these are mandatory fields. It will not stop you acquiring an ECG. It will stop you transmitting that ECG. So this is my patient here, and I have an emergency case. Let's do an ECG for this patient. Accept.
Transmit lang.
I will do the ECG. I will take that copy. I will do the fast management to the patient, and I will keep the copy with me. When I get back, finishing management my patient, with the copy I have, I will get back to my physician, ask him to place an order in the system.
Okay.
So I'll ask him to place an order in the system. I still have the copy with me. My colleagues, they took the machine and they did another ECG for another patient. So you can recognize the ECG you did by the date and time from the files here. So I have the files. Where is my
Manual
report?
transmission.
Then reports they were done for an emergency, say 2 or 3. Well, where is my report? So when you do a check on that one, this is the report. You can compare it with the date and time you have here. So if you couldn't read it, just expand. You will find the same date and time. After you place an order in the system, you will find the order under the order list. So my report is still open. And I will find here the report which was, the order which was placed from the system. You can press on it. It will be attached. It will autofill all of these spaces. Then you will add your name, do save, and do a manual transmit. This is one way. The other way, if I open that report, I can, after placing an order in the system, I can get back here, fill all spaces manually with the order number attached, do save, and send it to the patient's profile. But this is a really important ECG because it has the event on it.
Yes, like that.
So even if the patient has chest pain, you have the event in that event. It's really important for the patient to be saved. So you have to fill the spaces and send it to the patient profile. Clear?
Graaf.
Any other questions, please?